Hi guys, my name is Olivia. I am a certified clinical exercise physiologist, and today I'm going to be going over pelvic floor strengthening exercises. So this is going to be part of my pregnancy series, pregnancy and postpartum. So if you have ever heard someone say, I pee when I sneeze, especially after having kids, that is a sign of a weak pelvic floor. It's natural during pregnancy and after childbirth to have that pelvic floor weakened. So these exercises are going to help you build that pelvic floor strength back up. We also naturally have a weaker pelvic floor as we age, so I think these exercises are great for anybody to do. It's also going to be really helpful with postpartum. As always, please exercise at your own risk. If you have any questions or concerns, please consult your physician or healthcare provider.
So this first exercise is a side lunge. You can see that I'm using blocks here to staple myself and allow me to get into that deeper lunge position. I recommend holding this for 30 to 60 seconds on each side. You can hold a stationary lunge or you can go back and forth, which I will show in a second. The blocks are just going to help stabilize. That's really going to help later on in the pregnancy when your center of gravity is shifting. Again, each side 30 to 60 seconds. Start with one set, see how your legs are feeling. You can go up to 3 sets, 30 to 60 seconds each side before adding anything else to this. You could add a longer hold, add more sets of this. You could try without the blocks, but again, this helps with later into pregnancy. Now this is showing going back and forth instead of that stationary lunge hold. So that stationary lunge hold is going to be working those muscles, but also stretching them at the same time. This is going to be more of working those muscles than a stretch. So this is just going to make you go back and forth, side to side. I recommend doing 10 reps on each side. Start with 1 set and then go all the way up to 3 sets. And then you can add a dumbbell, hold it at your chest if you'd like to increase the intensity. This next exercise, you're going to lie down on your back, put your feet flat on the ground, and your knees are bent. This is a glute bridge. You're going to press into that mat with your feet, bringing your hips and glutes up off the mat there. And you're going to go basically into a diagonal line. Make your body into that diagonal lines. We're not hyperextending our back, but we are working our hips and glutes and lower back by bringing our butt up off the mat here. I recommend starting with 10 reps, 1 set. I wouldn't add anything to it first. If you are a beginner with this exercise, you can work your way up to 10 to 12 reps, 2 to 3 sets before adding anything to. If you have a block available, you can put it in between your knees. Same position, lying on your back, feet flat on the ground, same movement, pushing those hips up into the air. But now we're also working our pelvic region by squeezing that block in between our legs. We're going to activate different muscles as well as the same muscles we were just activating. So you're going to add muscles to this exercise. Starting again with 1 set, 10 reps, working your way up to 2 to 3 sets, 10 to 12 reps each set. This next exercise is another variation of the glute bridge. You're going to go into that regular glute bridge and then take your knees from shoulder width apart to tapping each other and then back out again. Again, this is going to activate other muscles in addition to the muscles that we're activating during our regular glute bridge. So when you go up, keep those hips lifted in the air, tap those knees together, and then come back out. We're activating our pelvic region muscles as well as our hips, our glutes, and our lower back. This exercise is going to be great in strengthening those pelvic region muscles and those muscles that are needed during labor. So this is going to be a great labor prep exercise. This next exercise also helps strengthen and open up that pelvic region. It's going to be a deep squat. So feet a little bit wider than shoulder width apart. keeping those knees behind your toes to keep the pressure off that knee joint. And then you're going to sit back as if there was a chair behind you, going as deep as you feel comfortable going, never going to a point of pain, just to a point of tension here. You can go down and hold at the bottom of the squat for a few seconds before coming back up to increase the intensity. You can also add a dumbbell as shown here, holding that weight at your chest, whatever weight that you feel comfortable using to increase that intensity. I recommend starting with no weight, no resistance, and starting with 1 set, 10 reps, increasing your reps and sets before adding resistance, such as that hold at the bottom or adding a dumbbell. This next exercise is a sideline hip opener. Again, we are activating those pelvic region muscles. You're going to lie on your side. You can have your arm in a tripod for stability. You're going to keep your knees bent and you're going to open and close kind of like a butterfly, like a sideline butterfly instead of seated. You're opening that top leg up. Doesn't need to be very far, as you feel comfortable going until you feel some tension, and then bringing that knee back down towards the floor. Again, I recommend starting with 1 set, 10 reps, and then increasing reps and sets before adding resistance, such as a band, which I will show in a second. Here is that same exercise, sideline hip opener, but this is what it would look like if you did add a band. That band would go right above the knees on both sides. Make sure that that band is stable, and then it's going to be the same movement opening up. You're just going to feel a little bit more resistance. So it's going to increase that intensity on those hip muscles here, hip and glute muscles. So again, we're activating that pelvic region, we're strengthening those muscles. That's going to help a lot during pregnancy as well as post-pregnancy for recovery, labor, and during pregnancy. This next exercise is going to be a minor movement, but really helps open things up. These are pelvic tilts. So I recommend doing this on a stability ball. You're going to activate your core a little bit during this, but it is a small movement, tilting your pelvic region forward and back, kind of rolling a little bit forward and a little bit back, just through that hip region. We're not activating anything in our upper body or anything below the knees. This next exercise is going to be a stretch for that pelvic region, as well as opening everything up around there too, making pregnancy, labor, and postpartum a bit easier on you. So you're going to start by taking that back leg straight back, and you're going to bend that knee, that front knee. You can lean forward down towards the mat, but you don't have to. You can keep your hands pressed on the mat if this stretch is too deep for you to begin. So you can start back with your hands flat on the ground like this. This is going to stretch out that pelvic region here. Now, I recommend holding this stretch for 30 seconds, 30 to 60 seconds on each side. Start with 1 set. You can increase your sets as you start to feel a deeper stretch. I would also recommend starting with your hands flat on the mat, and then as you stretch out more consistently, you can lean forward as long as that belly is allowing. Again, later in a pregnancy, it's not going to allow you to lean forward as much, but you're still going to feel that stretch, and we are working on a use it or lose it system. All right, if you found this video helpful, please like, subscribe, and share. Thank you.